Hi, my name is Magali and I work on the marketing and communications team here at Mary Center. We're here today because April is Sexually Transmitted Disease Awareness Month, and I wanted to touch base with some of our sexual health team to talk about how to stay safe, especially during a pandemic. Even though COVID-19 is the most talked about infectious disease at the moment, I think we all need to remember that it's still possible to contract other types, and that's why we're here. As a partner in your health, Mary Center truly believes in giving you the most important information to help you live your life as safe as possible. We're here to support you, and that's why, in addition to asking questions such as, are you being safe about COVID-19? We're going to be asking you, are you having safe sex, and have you been tested? That being said, I want to kick us off by asking our very own infectious disease physician, Dr. Ali, what exactly is an infectious disease?
Thanks, Magali, and hi everyone, welcome to our chat. So basically, germs are found everywhere. They're in the air, soil, water. There are germs on your skin and in your body. Most of them are harmless, and some are actually helpful. But some of them can make you sick, and infectious diseases are germs that can make you sick. Coronavirus, or COVID-19, is the infectious disease that we've been hearing about the most these days. Common symptoms include fever, cough, and shortness of breath. A small number of people who get coronavirus might become quite sick and need to go to the hospital, but many people will get it will only have mild symptoms and recover well.
Great. So does this mean that STDs are similar to COVID? And if so, how?
Sure. So both are spread through person-to-person contact, but the difference is the way that they're spread. So while the virus that causes COVID is mainly spread from respiratory droplets, usually from a sick person when they cough or sneeze near other people, or it's possible to get sick from it if you touch a surface that has the virus on it and then touch your mouth, nose, or eyes. That's not the case with sexually transmitted infections, which are only passed through sexual contact. One of the ways that the two are similar, though, is that you can pass the infection from person to person if you don't have symptoms or show any kind of signs of having the infection. Another important thing to know is that the viruses don't discriminate. Anyone who's exposed to a sexually transmitted infection can get infected, just like anyone can get coronavirus if they come into contact with the virus.
So got it. Is it possible to contract COVID-19 from sexual intercourse?
Sure. So COVID-19 is not an STD, but it is highly contagious. So you can get it if you have close physical contact with someone who has coronavirus.
Got it. So essentially it can't be caused by actual sexual intercourse, but it can be caused by foreplay. So kissing, hugging, being in each other's space.
Absolutely. So the virus is, generally being within 6 feet of someone who's infected with the virus that causes COVID for longer than a few minutes can put you at risk for getting it. It's also spread through saliva, so kissing is very high risk for transmission.
Got it. Thanks for that really useful information. So I'd like to move on to Ram. Your job as the outreach coordinator is to educate people about the importance of having safe sex to avoid contracting infectious diseases. So can you tell us a bit of recommendations for staying safe?
Absolutely, Magali. So whether it's COVID or a sexually transmitted disease, the most important thing is using barriers, which means wearing a mask, gloves, and other protective gear to avoid contracting COVID. And when it comes to STDs, you want to use other barriers there, such as using a condom. This will protect you from contracting an STD. So for COVID, one tip will be to keep your distance and wear a mask. When you do have to go out, limiting your interactions, keeping a space of 6 feet between you and other people, and always remember to wash your hands. This can reduce the chance of you contracting coronavirus.
Thanks. So if you find that someone you're sleeping with contracts something, whether it's chlamydia or COVID-19, should you proceed with having contact?
Absolutely not. I recommend to immediately stop any sexual activity with that person until you both get tested. If your partner has COVID-19, avoid sex and kissing your partner, foreplay as you mentioned earlier. If you suspect that your partner has an STD, stop having sex with them. This is a way that you can protect yourself from getting sexually transmitted infections or STDs as well as COVID-19.
Great. So when would it be safe to see them again?
Well, if they have COVID-19, if they tested positive for this, right now the Centers for Control and Prevention state that people can stop isolating themselves after 72 hours, that their symptoms have improved, and it's been at least 7 days since they last felt sick. If they tested positive for an STD, they want to avoid all sexual contact while they're being treated for sexually transmitted infection. If your treatment is a single dose of medicine, you should not have any sexual contact for 7 days after your treatment, so the medications have time to work.
What should an individual do after they're tested?
Well, depending on the result, my colleagues can speak more about these next steps.
Faith, you're the HIV prevention coordinator. What would you recommend that someone do with a negative test result?
Well, with a negative test result, that's a really good question. And the biggest thing is to continue to stay safe, continue to practice safer sex practices so that you can maintain that negative status. So there's plenty of things you can do, as we just talked about. You can continue to use condoms or increase the use of condoms and more than what you're already doing. You can also limit your sexual partners or have conversations at least with your partners about what type of sex they're having, if they're having other partners, so that you kind of know what your possible exposure to other STIs are. And then the other things would be to utilize resources such as PrEP and PEP. So PrEP is an acronym for pre-exposure prophylaxis. And what that is essentially is a daily pill that a person can take to prevent themselves from becoming HIV positive. So they can kind of compare it to birth control. It's like you take it every day. If you get exposed to HIV at any point in time, then it is a very low chance that you would ever become HIV positive. And there's the same thing with, a similar thing with PEP. So that's PEP. If you think in the last 72 hours you've been exposed to HIV, there's a pill that you can take so that if you were actually exposed and you won't become HIV positive. So they kind of compare that to like the Plan B pill of pregnancy. Like there's a pill you can take to prevent yourself from getting HIV. And if you're not on that medication and you think you've been exposed, then you can take PEP. So I would definitely say that the two things are, after you get that negative test result, you want to assess yourself and say, okay, what can I do to make sure that, I stay on the right course, I have a really fun, active sex life that is very safe and that allows me to remain free of any sexually transmitted infections.
Great. So who's a good candidate for PrEP and PEP?
Well, pretty much anybody who's having sex can be a really good candidate, just because you never know what could happen. Condoms break. There are times where people, they have the best intentions to use condoms, but they don't always do so. And so I think that anybody, but definitely those who have more possibility of exposure to HIV. So if you know that maybe you have a partner who has multiple other partners, or you're not sure what they're doing sexually, if you know that using condoms has been kind of a struggle for you and it's something that you don't do all the time, those are some people that definitely could benefit. Additionally to people that may be in some communities that unfortunately are marginalized and are heavily impacted by HIV, maybe that could be something that you can consider as a part of your sexual health toolkit.
Wonderful. So should people still be taking PrEP during this pandemic? I mean, I know that a lot of people are social distancing, so what if they're taking PrEP and they say, well, I'm not actually out there, I'm not sexually active. Should they continue on PrEP?
Well, definitely, I think that when times like this, you kind of don't know what's going on, it would probably be best to try to maintain your medication regimen at the time, just in case. I mean, there's some people who are really taking the social distancing very, very seriously and will not be seeing people, but there's some people who even live with their sexual partner, and maybe that person has not gotten tested in some time and they didn't want to go outside. So, you maintaining your PrEP will make sure that whatever is going on with that, you're protected. And additionally, because you know that when you do take PrEP, there's like a 7-day startup period to get it to its highest level of effectiveness. So if you were to stop taking PrEP during this time, and let's say, they say we can go out and stop self-isolating, you will have to take an extra 7 days before the PrEP starts back working up in your system. So if you just maintain it, then you don't have to worry. And at any point in time, you will be able to have that protection whenever, if ever you do have a sexual encounter. And so people are still taking their PrEP right now. They're starting PrEP right now just to prepare themselves, or because they know that, in this time of self-isolation, they may have one sex partner that they have vetted and asked, have you been around people? Have you been exposed to COVID? No, and they've decided that that's something that they can do. So the PrEP can definitely be a great asset in those times.
And how can someone get PrEP? How can someone talk to the provider and say, I would like to get onto PrEP?
Well, you should be able to talk to any medical provider about starting PrEP. So if you have a primary care physician, the best option would be to talk to them about it and ask them. Sometimes you may not have a primary care physician, or the physician may not know as much as they would like to about PrEP. And so I think that Mary Center is a great place because our providers are well versed in PrEP, and they can get at least to the team or any provider who knows how to start it and knows how to get you good follow-up. So if you're interested in starting PrEP, you can call me specifically. My number is 202-379-6131, and I will get you an appointment and we'll get you started on PrEP right away.
Oh, awesome. Well, so let's say someone receives a positive STI result. How should they proceed?
Well, I think my colleague, Deandra, she could definitely talk a little bit more about what the treatment side looks like. But once you get that treatment side, definitely the same course of action as a negative test result. Once that STI is gone, or even if you do have one that lasts, that's going to last you for a lifetime, which some of them do, you can still practice safer sex to make sure that you continue to not get any other STIs, or that you don't give STIs to other people. But definitely Deandra can talk more about the treatment side of a positive result.
Great. So Deandra, you're the HIV care coordinator at Mary Center. Can you elaborate on what someone should do if they have a reactive test for HIV during this time?
So typically, especially with the pandemic, if someone were to have a reactive test result for HIV during the pandemic, of course, whomever tested them, or whether it's an organization or just I guess one of the outreach workers or community health workers, they would typically reach out to me, give me a call or email me, but more than likely a phone call. Try to get them on my schedule so we can have a care coordinating consultation, where I could then try to bring in, a form of care connection with them and one of the providers that's on staff, rather Dr. Ali or David Cornell or Chakoma DeRocha.
So what kind of resources are available to people right now?
So current resources that are available, we are still offering transportation through Mary Center, but only for patients living with HIV within our Ryan White program. Other organizations are also still offering transportation resources. We have a lot of different businesses, small businesses and churches that have participated with providing with food options, rather meals or pantry items. And then you also still have DC's Department of Health for, let's say, newly reactive patients or established patients that may have coverage issues to receive medications, and they are still providing them with medication programs.
So that's really great to know. So someone would come to you and you would assess the situation, and then you would establish what resources they qualify for or what is available to them at the moment.
Yes.
That's really great to know. Thank you all so much for your time. This has been a really great conversation, and I really hope that whoever's watching had some questions answered, and knows that Mary Center is here to continue supporting you guys, and doors are open. I mean, we're scheduling virtual appointments, so you can be connected to healthcare at any moment. So as a reminder to anyone who's watching, if you'd like to talk to someone directly on our sexual health team, including the wonderful people that have been part of this segment, you can email them at besafebesure@marycenter.org, or you can call them at 202-699-2163. We we understand that staying healthy during this time means much more than just avoiding COVID. So like I mentioned previously, this is the reason that Mary Center is open and we're offering appointments to new and existing participants in the comfort of their own home. If you would like to make an appointment, you can call 844-796-2797, or you can visit our website at www.marycenter.org. Okay, thank you everyone.
Thank
Bye.
you.